Board exams, the professional hazing ritual we all pretend is normal. If you just certified or recertified, congratulations. And also, welcome back to the land of the living. Today, we're breaking down boards, prep, burnout, study strategies, and emotional aftermath that nobody puts in the prep books.
Hello, and welcome back to the Resting Stitch Face podcast. I'm your co-host, Dr. Sarah Harding with
Dr. Erin Sheffield. Welcome back.
Yes, so the time is upon us. We just had match day and then followed by, I guess, written boards for some and then followed by oral boards for others. It's changed a lot since we've finished, hasn't it?
Oh, yeah.
And it's interesting just because it's only been 10 years, I guess, 10 years, 11 years.
Mhm.
And I think it's wise to talk about it. I think it's a very interesting topic that I'll never, ever, ever understand.
And isn't it weird? I think all of those together happening at the same time of year, it was such big stakes and so important at that time. And now it's kind of like, oh, yeah, I guess that just happened for people. Like, it's so nice that it's far enough behind me that I do have those glimmers of trauma memories, but also like, oh my gosh, phew, I'm so glad that's not me anymore.
I know. Let's start talking about initially when we're in dental school, we have to do, and dental school is a little different from medical school in this
Mm.
way, but we have to do our NBDE, National Board Dental Exam, which is the writtens, 2 parts, right? And then we do a clinical board that's state or regional based, based on, and you have an actual live patient for parts of it. So some of that, there's a written part as well. And then there's some, I think that are typodont, like on the
Yeah.
little dentiforms. And then you have a patient. And so you're going crazy trying to find a patient, right? And correct me if I'm wrong, but I think it's pretty normal throughout that when we were getting a patient, you're not trying to find like a big cavity to fill. You want like the minimal, clinically acceptable version of a cavity in order to not have any sort of surprises, right? Because the patient in and of themselves can be a surprise.
Right.
And so you don't want the decay to give you any surprises, like, surprise, here's the pulp, yay. And it just seems very archaic and also a little bit questionable on the ethics side of things.
Well, I think to go along with that, at least when we were doing it, and our mentality was it was almost like you wanted an incipiency that maybe you wouldn't even usually fill. So, and in our school, they made it sound like they had this amazing system in place. And I've heard of places where you have to pay patients and they sit in the lobby and find out how much the other person's getting paid and they start bargaining and they hold you hostage. I'm not coming back to do this unless you give me this much more. Could we like all came together and decided unionized in the lobby.
Right.
Luckily, we didn't really have that kind of mentality. I don't think we were even paying patients. It was just come and get free care and yay. But they made it sound like they had this amazing system. Don't worry, bring your patient. And if it doesn't work out, there's going to be a room full of people waiting as backup patients, everyone's patient that didn't get accepted, whatever. And it was so hard. My friend was a general dentist in Cedar Rapids, and she found me a perio patient and she found me a restorative patient, thank goodness. But then I was having a really hard time finding another patient. I finally found one, and he was really iffy about if he was even going to come and if he wanted to get it done. And then he came and he was like, I don't think I want to do this. I'm not sure it needs to be done. And I said, would you please, if the examiner accepts you as a patient, can you accept that as a second opinion that it would be good to get done? And so he said, sure. But then the x-rays went down. And so they had to wait. It was like 2 hours to decide. And then he finally came back and said, no, I don't want to do it anyway. So at that point, everyone was like finishing up at that point, and I'm like, oh my gosh, I don't have a patient. All of a sudden, it's hours in, and I go to the waiting room where
thousands of dollars, and they're not going to get their money
backup
back.
people are paying supposed to be, and there's not a single backup person in there.
Oh.
And I'm like, oh my gosh, I am going to fail just because I don't have a patient. And I was flipping out, like, oh my goodness. And my friend's sister, who was a assistant or a hygienist, I can't remember which, she had come to assist her on the board because you could have an assistant. And she said, I think I have a class 3 between my 2 front teeth that I never got restored if you want to do that. And I was like, oh my gosh, really? And my friend's like, take her. So we got an x-ray, and sure enough, and I ended up doing it, and I ended up finishing.
Oh my
But I was
gosh.
so far behind because of the X-ray situation, and so everyone was well into their endo portion, and I was like, "Oh my gosh, I do now," and they're like, "Well, you can have a little extra time, I guess, since you're getting started late, 'cause that's not your fault and everything," so I got started, and the one part that went well for me was the endo section because it was just a typodont. I didn't have to worry about patience, because my
Okay.
other restorative patient, I had placed this amalgam, and it was the most beautiful amalgam I'd ever done,
Love amalgam.
except
Love it.
the contact was too heavy,
Mm.
and I was in a panic, and I didn't know what to do, and I should have maybe tried to do, like, a diamond strip or something to line it up, but I just, like, "I don't know what to do. I can't floss through it very well. It's breaking." So I drilled it out, and then she started freaking out, and "I'm tired of being here, and I can't sit here long enough," and I'm, like, begging her, "Please, just sit and let me finish this. I have to finish it."
Yeah.
And so she was freaking out and crying and just losing it. And so I'm like doing as fast as I can. So then it was very Goldilocks. Too light of a contact. And so she wouldn't let me fix it. And so they went back and I got this needs to be repaired, but it was like barely a pass. And I was like, oh! So by the time I got to the endo part, even
You're
though I was
frazzled.
I think 2 hours behind. I went
Mhm.
in there and I did my thing. I got it done so fast. I was the first one done.
Whoa.
It was like God or the angels or someone was just like, "Finally, I'm throwing you a bone," and I passed, but, like, there were so many things working against me,
Yeah.
and I remember someone who failed in the class ahead of us the year before was the top guy in the class, and he was going into oral surgery, and the number 1 guy in the class failed. So, where are the ethics and the
Right.
utility of
Mm.
these boards where the
Mhm.
people who are passing maybe the lowest and the people who are failing are a lot of the time failing because of a patient factor that you can't control.
Yeah. Yeah. It's funny, I hardly remember mine. I remember being there the day, and one of my friends had a couple of lesions, and so he had everything that I needed,
Oh,
and
that's so
so
nice.
yeah, and I ended up taking him out to a nice dinner to, as a thanks, and he was, like, a super chill dude, and just was a great patient, so it wasn't super duper stressful besides stress of it in and of itself, you know what I mean?
Which one did you take? Do you remember? I took
Serta.
Reb.
Yeah, I took Serta, which is, I think, now blended with credits.
Okay. I remember they had always taken, I think it was probably credits, like Chicago or Illinois took that one. And then
Oh, yeah.
this time they were taking Reb. And I was so relieved because there was something that we didn't have to do.
Mhm. Yeah, we didn't have the perio, like, the live patient perio portion.
Right.
Work at that.
But I also think it's interesting, dental boards. I can't think of another instance where you as a healthcare provider are allowed to practice on a live patient without a license.
Yeah, at least in the United States,
Right.
right?
Like
I
I
guess
guess technically you're practicing under the examiners.
I think you have to get, like, a little malpractice thing.
Yeah, maybe.
I can't remember, though. And we did that, like, Mission of Mercy and stuff, and so that was still
Mhm.
while we were in dental school, but there was docs around, I
Right.
guess, and so I think for humanitarian things, maybe you don't need it. I don't know.
Yeah, I think you're still practicing on your dental school license, maybe. I don't
Yeah.
know. I just thought it was weird. It's so stressful. It's so expensive. Like I said, I'm so glad I wasn't held hostage by the weird patient dynamics that I've heard about. Oh gosh.
Yeah.
And then I wish they had a national board instead of all these regionals. And
Right,
if you
because they
try
don't
to
all
move, I think we're old enough, we could probably get a license most
Mhm.
anywhere, I would hope. But I remember if you try to go somewhere too early, you can't. And one of the residents in our residency program was from Florida. And I don't know why he didn't take the Florida boards, but he was practicing under a resident license. So he didn't have a real dental license. And so when he was trying to go back home, Florida has its own board and he had to take it. And it was a nightmare.
Yeah,
I think he had to spend like $50,000 or something. He had
it's a
to
racket.
take a course because it's been 4 or 5 years since he's
Mhm,
drilled on a patient
mhm.
or done a perio, anything.
Yeah,
And they had to obtain the patients for him and everything because he's not
mhm.
there to
Right.
obtain it. And so
Mhm.
I just thought that was so crazy. And again, after you go through dental school, it's not like this is happening early on and you're just finding people off the street to see if they can pass. Like we've all meet all of the requirements. So to me, it just seems funny that you could pass dental school and then that wasn't enough.
Yeah.
Like, are people really just like shoving people through dental school, letting them finish if they're subpar? Maybe.
Yeah, because the other thing is that there's people that don't pass or don't think that they can pass, and so they go and do, like, an AEGD, and there's certain
Yeah,
states where completion of an AEGD gives you the ability to get a license without having taken any of those.
sure.
'Cause that's a little scary too, but, on the flip side of that, now that we're oral surgeons, the oral surgery board doesn't have a patient portion, right? And so, can we talk a little bit about that? Like, about the whole process of oral surgery boards?
Oh, for sure. It needs to be talked about. Let's
Yeah.
talk about it.
It does. This just happened last week, and so, I'm sure that all of those people that took it are happy to be done. But, when we are in residency, we take a little exam, resident exam, the ABSite. No, that's not what it's called. OMSite. It's supposed to be indicative of like how much you know, and it's also a little bit indicative of how you would do on the written boards, right?
Right.
But it's sort of as an afterthought, like, "Oh, guys, OMSITE's coming up. Harding, you're going on Tuesday." And it's like, "Ah," And so it's not like you're really studying for it.
Let you do it during work hours? We always had to go on Saturday.
I don't even remember. There you go. Yeah. Now that I'm thinking, I don't know. I don't remember. But I don't know that I didn't really understand the validity of that. I know that one time they had my name wrong or something, and so I went to go to take it, and they were like, "Sorry, the name we have doesn't match the name on your ID." And I was like, but it's me." And they were like, "Sorry, can't take it." And I was like, "Okay, then what do I do?" My program director's all upset with me, and I'm like,
Yeah.
eh, what did I do? I didn't sign myself up for
That's
this
funny.
with the wrong
'Cause I've
name."
had the opposite. When I tried to take my DAT, they sat me down in front of someone else's DAT, and if I had not realized, I would have taken it and been going, "Where's my score? Where's my result?" And I would never have
Oh,
got it, and
wow.
someone else would have got my score. And then something similar happened when I was taking, I think, either the dental board or the OMSI. Again, I think put me in the wrong.
Oh,
And they're
weird.
like, they like make you do fingerprints and like eyes and blood analysis.
Yeah.
It feels like they're doing everything. You have to have 12 IDs turning you away. And then me 2 times for these big tests. They like, totally
Wow.
botched it. And I could have taken tests like if I were trying to cheat, I couldn't have even tried to do that. But
But there you go. And so then now residents are able to take the written portion while there's the fast track or whatever, right? So residents are able to take the written portion in their chief year.
oh, I didn't know that.
Yes. And so
Wow.
then once they get out of residency, 6 months later, they're taking the oral boards, which would have made so much more sense
I had
because
no idea.
that's what all of the other, like, medical specialties do. They're all taking their writtens while they're in residency, and then they take their orals after soon after they finish. But here we were, a year and a half out, just trying to get your footing in life and trying to study for boards, and you're like, "Oh my
Oh,
gosh."
gosh.
And so, like, I don't know about you, but my first experience with it was I was on an aircraft carrier, and I got there in, I don't know, July, and then in August, I started the paperwork to ask for a reservist to come on board so that I could leave because I knew that we'd be on deployment. So I could leave to go take the test. And I was emailing the board to ask, is there any way that I can take it in Europe somewhere? Surely there's center where I can do that. It's just a computer test. And they're like, nope, you've got to come and take it in the States. And I'm like, ugh. And so then everything is in the command, like all of my paperwork for the request to take the boards, all of the things. And it's getting closer. I haven't heard anything. It's getting closer. I haven't heard anything. Finally, they're like, okay, I think we might have a reservist, but I'm not sure if we can get you off to go take it. And I'm like, "I don't know. What do you mean? So you're gonna have 2 oral surgeons on board? Like, that seems ridiculous. And also, you could have figured this out when I submitted my paperwork months ago." But again, it's the hurry up and wait. And then as it's getting really close, they're like, I had submitted for 2 weeks because that's how long the reservist was coming in. And they were like, "Nope, we're gonna fly you out, and then you've gotta fly back the day after you take it." And I'm like, "Oh my gosh, but like, what happens if there's a hiccup? What happens if
Right.
travel is travel?" And
Right.
and so it all came around, and at the end, it was hard for me to study because I was like, "Am I going? Am I not? Am I going? Am I
Oh,
not?"
sure.
And then they were like, "Okay, you can go. You're leaving tomorrow." And I'm like, "Ah!" And so I flew off the ship, I think to Bahrain, and then I flew from Bahrain to Kuwait, and something happened with the flight crew that they were, like, over hours, and so we couldn't leave because we didn't have a crew to fly us. So I got stuck in Kuwait overnight and I'm like, "Oh my gosh, I'm not gonna have any time." And so I'm back on my computer emailing them like, "Hey, I'm stuck in Kuwait. I'm afraid what happens if I don't make it?" And they're like, "Oh, well," or I don't really get much of an answer, and I'm like sending an email to my chairman and from residency, and I'm like, "What do I do?" And he's like, "Well, let me reach out and see if there's somewhere else, something else, what we can do." And
All of this for a computer test.
I know. And then I finally make it to Dallas, and I have 18 hours or something before the test starts. Mind you, I've been on the other side of the world, and so my circadian rhythm is totally effed, right? And I drive into the parking garage of this Prometric Center, and I get an email from the secretary lady at the board saying, I think that we can get you in at a place in Europe. And I'm like, "You've got to be kidding me. I asked you that months ago, and now here I am pulling into the parking lot,
Oh
about
my
to fall
gosh.
over. I'm so tired."
After
And
how many hours of travel? Like
unbelievable.
30, 40?
And so then I get in there, I sit down, I'm taking the test, I fall asleep. And this is coming from a girl that can't nap, can't.
No!
I'm like, "Oh my gosh. Oh my gosh." So anyway, I failed. There you go. That's my story. And then I was terrified to take it again. So that's why I waited.
Oh, I'm sure.
Because I was like, "Screw you people." I tried to mitigate all of these things that I foresaw, and you were not helpful. And what is even this good for anyway?
That is crazy. Well, I passed the written part just fine. Then the in-person oral saying oral exams is funny when you're an oral surgeon because people
It
are
is.
like, "Of course you took an oral exam." I mean, no,
I
I
know.
mean, I'm talking about like going and
Yeah.
talking
Verbal
your way
exam.
through
My verbal
cases, a
exam. Yeah.
verbal exam. And that experience was interesting because at least at that point, I'm not sure if they changed it. They do it at the OB, like
Oh, because you
American
did it in
OB
Dallas.
Association headquarters. Is that where
Oh,
you did
yeah. So now,
yours?
no, it's in Raleigh now. I did mine in
Oh, it's in
Raleigh.
Raleigh.
Yeah.
Okay. But at that point, it was there, and I remember there's, like, armed guards there,
Yeah. It's
I was told
weird.
because of all the weird abortion wackos or something. Because I mean, maybe they have
Oh,
armed guards
wow.
at the Amos.
Mhm.
And so you are there I feel like they did a breakfast before or something, and everyone's pretending to be all friendly and confident, and then you go in, and they had all these rooms, and you just get assigned a room, and you walk in, and they just start grilling you, and they grill you until you dig yourself into such a deep hole where you don't know answers and you feel really dumb. And maybe that's not a bad sign because it means you knew so much you got down into a hole where you didn't know.
Yeah.
But it's intimidating at the moment. And I had just had twins and I had planned on studying more, and the twins came early. And so I
Oh my
didn't have as
gosh.
much time studying as I'd wanted. I was commuting 75 miles each way. And so I'd get home from work and I'd be so tired. And so it's not like studying was going as well as I would have liked anyway. When they came a month early, I was not expecting to lose all of that time. And then I studied pretty much zero from the time they came till the time boards were there because we weren't sleeping because I had twins and you have to
Mhm.
feed them every like hour. I mean, it
Yes.
was terrible. And so I'm barely back at work. I'm barely functioning. I'm driving far. I've got these little babies that are up every hour, it feels like. And so I was asking people, should I even take this? I should not take this,
Mhm.
right? And everyone's like, no, just take it. You might do better than you think.
Mm.
It's good practice. So I'm leaving my babies, which again, I hear people like, my baby's 2 years old. I never left them. I left
Right.
two babies within weeks of having them to
Golly.
go and take boards. And I I got into one room with this older gentleman, and he asked me the difference between a absolute and a relative crossbite. And I started saying that you would move the models, the mandible and the maxilla to check in the new position. And he thought I meant that I would ask the patient to move their maxilla. And he was half
Hmm.
deaf. He couldn't hear anything that I was saying. And so I was trying to say, no, that's not what you cut me off. That's not what I was saying. I'm talking about on the models.
Yeah.
But as soon as he thought he heard that I would ask the patient to move the maxilla, he, like, lost it. He just was like, "What? Oh my gosh. You would what?" You could tell he's just like, "What kinda dummy are you?" And then he wasn't hearing me well, and so after that, I lost all rapport and we spent
Oh
all
my
this time
gosh.
trying to backtrack, and so that did not go well, and I ended up failing, and the head of the board at the time, I was pretty close to, and he's not supposed to be able to look up, but somehow he reverse manufactured the algorithm and pulled my score, and he said I failed by, like, less than a
Ugh.
0.1%, like a fraction of a 0.1% or something like that. And so I'm like, if that man could have heard what I was saying and didn't
Mm,
think he knew what
mm-mm.
I was saying and think I was a total idiot, I would have passed.
Yeah.
So
Yeah.
I was really upset. I don't think anyone should have to go through that more than once. It's so stressful.
Yeah. And then so how long did you just take it again the following year, or how did you do that?
Yeah.
Okay.
So I studied so hard after that.
Mhm.
I spent an hour pretty much every day studying. I was constantly quizzing. My husband would even be like, "Why are you studying this nitpicky, gritty? No one's gonna ask you
Yeah.
that." And I'd be like, "This isn't like ENT boards.
Yeah.
They did. They asked me it last time, so I am
Yeah.
studying it." But I will say I'm actually, in hindsight, kind of glad that I failed because I had such imposter syndrome at the time that when I felt like I just barely scraped by,
Yeah, it
I
wouldn't
would
have
have
really.
always felt like, "Yeah, I passed, but barely. Am I good enough? Like, maybe I shouldn't have." By the time I passed the second time, I know I passed with flying colors. It was almost fun because I knew things
Mhm.
so well. I was just so much more confident. I'd
Mhm.
figured out how to some was just a strategy of the test, the way you talk to them, etcetera. I
Yeah.
figured all of that out, and so by the time I passed, I just felt so much more confident, and so for
Yeah.
me, that was actually maybe a blessing because then
Right.
I knew,
I
like,
can see
"Okay, I
that.
deserve this.
Yeah.
I deserve this." So I don't begrudge my failing, and maybe the less than a fraction of a percent was worth it just so I could have that experience, but it's
Yeah.
still terrible to have to go
I
through
know. It is.
and just feeling embarrassed and bad. But I think it's interesting that 2 out of the 3 of my co-residents failed that year and only
Huh.
like 66% of people
Yeah.
passed, and I remember being annoyed by that. Shouldn't
Mhm.
the written part be the screening part? Like,
Mhm.
shouldn't that be maybe the harder one if you pass that? Why are we trying to
Yeah.
weed everyone out? We already
I know.
passed finished a accredited residency program. Shouldn't that be something? And we already did
One
the
of the
written
things that
part.
One of the things that I heard was that they have to have a certain amount of people that don't pass because otherwise the quote unquote the test doesn't actually matter. If everybody passes, then obviously it doesn't matter. And so I think that that's part of their way of maintaining legitimacy. I was like, why am I studying this stuff? And my friend that I went to the Nashville course and I was staying with my friend whose husband's a plastic surgeon. And he's like, well, part of the boards is they know that the primary scope of practice is this, but in order to stay legitimate in terms of the broad scope, they have to test on those things to say, see, look, all of our board certified oral surgeons understand these things because that's part of our scope. And I'm like, I mean, I get that, but for goodness sakes. So,
I feel like 66%, like
right.
two
I think that was
thirds,
the
like,
passing rate of my oral boards too, I think.
I think it's higher
Yeah.
now, which I appreciate,
I don't know, I
but
just took it a couple years ago. So, I took it
well,
in 2022.
maybe.
I guess that's 4 years
I
ago,
don't
but
know. I just feel like it should be much higher. It should be 80 or 90%
right.
because I think you need to make the first test a little harder
Mhm.
if that many people are gonna fail. Because part of it's
Yeah.
so much time and it's such
It's
an
so
investment,
much time. Yeah.
and it's really hard. It's very
Mhm.
disruptive for your life. Like, you're studying for hours and
Mhm.
it's very stressful and you're paying
Yeah.
thousands of dollars and
Mhm.
your job might be on the line, your
Yeah.
hospital credentials might be on the line, all of that. So I wish
Yeah.
they would just approach it a little differently. And part of me is just saying, compared to other people I know, like my husband's board, felt like it was kind of if you spoke English and you'd passed everything before, you were going to do fine.
Yeah.
Sometimes I wonder if part of that is I think we as a specialty have a bit of a chip on our shoulder.
Yeah.
And I think that's because we're coming from this dental background and we're wanting to
Mhm.
be seen as legitimate physicians, legitimate surgeons, legitimate doctors. And people are always trying to tell us, like, hey, denty, or, oh,
Yeah.
you dentists. And
Yeah.
so I think we are trying so hard to, no, we're real doctors. And in the hospital in my residency, we were never allowed to say, I'm just a dentist. We could never cop out. We would get in so much trouble if
Yeah.
anyone caught a whiff of us even thinking that. And yet, The other doctors I know, like, I was just talking to some ophthalmologists, and they're like, "Yeah, we're eye dentists.
Yeah.
We're not even really doctors anymore. Don't ask us that kinda stuff." You know, and
Right.
they wear it like a badge of honor. My
Right.
dermatology friend is like, "I'm not a real doctor. I'm just a dermatologist." And it's just different
Mhm.
cultural
Yeah.
approaches, I think, but I don't know. I don't know if that's why we're so hard on ourselves 'cause, again, ENT, kind of a sister specialty where we have a lot of overlap and stuff. The boards were just a totally different experience for me
Yeah.
versus my husband, and our training was similar at the same institution
Mhm.
and all of that, so I just think it's very
Yeah.
interesting.
I my whole boards journey was, I feel, tinged with pregnancy, which is really interesting because
Is
I
that a
remember
requirement as a woman?
it
I feel
must
like
be.
every woman I know is like, "I was full-blown pregnant
Yeah.
during
Yeah,
boards,"
so
or, "I
that's like
just barely had a baby a week before." It seems like
yeah.
almost everyone.
Yeah, even my written boards, when I finally was like, "Okay, I'll try this again." I registered to take it, then because you register kind of early, like in the summer, and then found out I was pregnant, and my due date was January 7th, which is right around the time the written boards are happening, and so I sent the board a message, and I was like, "Hey, this I'm pregnant, and I don't think that I'm gonna be able to sit for the boards because I don't know when I'm gonna give birth,
Yeah.
and so I'm wondering if I can, like." I forget if I was asking for a refund or if I was asking something, and they were like, "Sorry, that's not a legitimate medical reason to not take it." And I was like, and so I just lost the money.
My gosh. It'd been fine if they just said to me, like, "Sorry, there's just absolutely no refunds." But what would be having
I
some
don't
horrific
I don't
accident or
know. I guess
something that you
so.
couldn't but going into labor at the exact same time as the test doesn't count?
Yeah, I don't know. Uh,
A-bombs, you need to work on that policy if
I
that's
know. And so I was real mad about that. But then when I finally ended up taking passing writtens and then I was taking boards, then of course I was like 35, 36 weeks pregnant with my second kiddo when I went and took the boards.
of course.
And I'm like just bebopping along with my big old belly, and I had emailed, of course, I don't think that I do this very often, but it sure sounds that way. But I'm emailing them and I'm like, hey, I've got a quick question for you. I'm like super pregnant. And are there accommodations in terms of like, can we maybe see if there's a room that you could assign me to that's close to the bathroom? Because I'm going to probably have to go pee every break that I get. And so like worked with me on it, which I was really appreciative
Oh, that's
of.
good.
Yeah.
I mean, at least
And
at that time, it was at the OB headquarters, so
well, no, ours was in Raleigh, remember?
yours was.
And
Dang,
so,
okay.
but the nice part about it, which this is literally the only time I'll ever say this, is that there was probably like, I don't know, 8 girls, 8 women taking the exam. It's all
And they were
men,
all
right?
pregnant.
Because no, but it was like that there was never a line for the bathroom because there was no women taking the exam. And so I was able to get in and out of the bathroom, but there was
That's
always the
true.
line and the men's for the men's
That's the
bathroom.
only time
And
where
I was
you
like,
walk right into the bathroom and the men are waiting in line. That's the only time I've ever experienced that whenever it's like a
yeah,
Amos thing or A-bombs thing.
yeah,
The
yep.
only time I've ever experienced that.
Yeah, and then when I passed, I was like, I think that probably my imposter syndrome, of course, is like, well, the only reason why I passed is because I was growing a penis inside of me because I had a son in my
The testosterone was helpful.
yeah. So I was like, they knew. Somehow they knew that I was there with a man.
Extra brain power really helped. It was
Yeah,
like
yeah, 2 brains.
two heads
Yeah,
are better
so
than one, as they say. Is that what they say?
yeah, and so I think, I always joke that that was the case, but again, that's like my imposter syndrome just shining forth for everyone to see. And of course, when I'm in the hotel elevator on the way down and somebody's like, "Are you a flight attendant?" And I was like, "No." They're like, "Your outfit, it just I thought you were a flight attendant. I'm sorry." And I was like, "All right, well, here we go. I mean, goodness sakes."
It's like when I went to the dental implant conference and I walked right up to the desk, the registration desk where it says like dental implant conference, oral surgery. And then I'm checking in and I'm like, hi, I'm here to check in for the conference. And they're like, for for the for the dental implant conference? Yeah. As opposed to wait,
Is there another
yeah, what
option?
else?
Can I
I
pick
don't
option
look like
B? Is it
I'm
better?
checking in for the oral surgery conference, I guess.
So
Yeah, that stuff
funny.
happens way too often.
Yeah, I know. I know. So then what do you think now, having all that aside, the boards in and of itself? I get so annoyed when people are like, you have to make sure that you see a board certified plastic surgeon or a board certified blah blah blah. And I'm like, what weird virtue signaling or whatever it is. Because one, in oral surgery, like we're not required to take the board in order to practice, right? Like you don't have
Mhm,
to be board certified. I
mhm.
took it because I was like, "Well, I'm in the Navy will pay for me to take it, and I know that when I get out of the Navy, people are gonna ask me if I'm board certified, and I'm gonna have that little, like, pain body that's like, 'No,' and I'll
Right.
feel like I need to make excuses of why, and so I was like, 'Forget it, never mind, I'll just do it,' you know? But when it comes down to it, somebody was posting about this the other day, is it's not testing your hand skills. I mean, they have an ethics portion, but obviously, it's a little bit different when you're being tested on your ethics versus when you're actually being tried and tested in real life. And I don't think that it just goes to show, oh, well, you're really good at the gamesmanship and you can,
Mhm.
that sort of thing. But it doesn't really say much as in terms of how good of a surgeon you are. I don't understand. Like, why do I pay dues now? What is being board certified helping me to do? It doesn't give me any access to CE. It doesn't give me any access to like anything that they tout as like, these are the reasons why you should choose a board certified oral surgeon. It's just, oh, well, now you've taken this test and stressed your whole life out for 2 years and then, or more, and then now you pay us dues. So now we hold you to a higher standard. And you're like, huh, that doesn't make any sense, you know?
Yeah. I think it's really interesting, and I think so much of it is just political. And just like we were talking about with the dental boards, the national dental boards, to me, that just felt like a big money grab. And I remember they were trying to reform, and they got all the different boards got upset because they were going to suddenly lose their huge revenue portion. If you go national, then what happens to Reb and what happens to credits
Oh,
and what happens to
yeah.
Florida and all this, and there's such a cash cow behind it. I mean, I think ideologically the board is supposed to be there to protect the specialty and to protect the patients. And hopefully they're doing that. For the most part, I appreciate Amos and I think they are doing a lot to make sure we can continue to offer sedation and things like that. And I think they're very involved and have a pulse on kind of the political environment and they're trying to help us. But yeah, I don't know that always. I think there are other reasons to choose not to be board certified. It can be a little red flag if you never get board certified. Is there a reason? Like you just couldn't ever get board certified or not?
Right.
But especially in our specialty, I think sometimes as people just aren't keeping hospital privileges, they're older and they've decided they're done. I'm not
Yeah.
gonna renew. I'm not gonna keep taking call. I've done my time, things like that. But I don't know. I also see a lot of talk, maybe not exactly the same thing, but about ADA and how there's
Mm-hmm.
such a minimal involvement in the ADA compared to before, and people are pretty disgruntled with the ADA. It feels kind of like they're in bed with the insurance companies instead of
Mm-hmm.
helping us.
Mm-hmm.
Um, rise above and be successful with the insurance companies or just fight the insurance companies. I think there's some really difficult, deep questions that I don't have answers to.
Yeah, and I don't really think that there's a venue to raise those concerns either. I think this is our
Yeah.
best bet is by doing this, but it's we've talked about that with the mega conference. It's the same thing. Why aren't we talking about the elephant in the room of private equity corporate takeover of the
Yeah.
dental field? And I see why, because that's who's paying for this whole conference
Mhm.
here. And so of
Sure.
course we're not allowed to talk about it. But I think there's so much of that behind the scenes that we just don't know about.
Yeah. I would like to see a little bit more of a focus from the board on diversity and inclusion as well. Remember on social media seeing the post of all the new board board members, and it
Yeah.
was a group of men, it's like 12 men. I wanted to say, but I had restraint, I did not. Where are all the ladies?
Yeah. They did make a post a weeks ago when it was Women Physicians Day with all of the, like,
I
females
mean,
that
they
were
have some
board
examiners, but
examiners.
there's not a single woman on the board, which I was told means that we don't have a chance of having a woman president for 5 or 10 years or something, best case
Yeah.
scenario if someone gets in there now. So, I think that
Yeah.
matters, and then people of color and all the different things, I just
Mhm.
think one part of protecting the specialty, I think, is being inclusive, and I think that's important for communities to have doctors who can be like them and
Right.
to be able to better care for their own community. That's
Yeah.
something I hope will continue to improve and have some more
Yeah.
visibility in the
Well,
future.
yeah, that and understanding that you've just told these people, and I know that there's people that have kids when they're in residency now, but I was told that I wasn't allowed to have kids while I was in residency. And so then as soon as you get out, you're
Clock is
30
ticking.
plus years old
That's why everyone's
and
pregnant during boards.
but then you're telling me, "Oh, sorry, that's not a medical excuse for why you can't take it."
Right, where maybe if we had women on the board, they could talk
Right.
about those policies and talk about how that, maybe you get to defer for a year and keep your
Yeah.
money.
Right.
We'll take your money for next time.
Yeah.
What does that really hurt anything?
Yeah.
It's not like you're like, "I'm gonna hurry and get pregnant to say that I'm not ready for boards because I don't feel ready enough."
Right.
It was like a 9-month lead up, right? Or a 7 month
Right.
or however many. If you're in your 3rd trimester, then or, maybe.
Yeah.
If you're listening, A-bombs, these are really good, important ideas.
Hint, hint.
So we have just a few more minutes. Do you have any thoughts, other thoughts? What about board prep and things like that? Did you have any big tips you
I
studied
always
more
say this.
recently?
My office mate in the Navy said this to me, and thank you, Shin, for this because it was life changing. But he said, I was so focused on that boards is antagonistic and that they're trying to get me and they're trying to
Yeah,
trick me and they're trying to da da da. And it's not that way. And I actually really enjoyed taking boards. I really enjoyed the world boards, like for whatever reason. Like I was stressed, but I really enjoyed it. And the reason I enjoyed it, I think, was because he told me this. He said, Sarah, it's just kind of like a dance. And so the examiners are the lead and you just follow the lead. And so you just go where it goes. And if they turn this way when you're expecting them to turn that way, don't worry, just go this way. And just follow their lead because they're doing it because of timing and they're doing it because of this, or you're doing well and they're just going to steer you in this other direction because you still have time. And
right,
so just don't let those little things take you off of your path. Just follow the lead. And so in that way, it was like a beautifully orchestrated symphony. And we just kind of went with each other and back and forth and, spun around and came back. And it was just very peaceful, pleasant. And I really enjoyed that. And that metaphor made so much sense in my brain. And it gave me that nervous system reset to be able to take a breath and relax. And in doing so, I really felt like I was able to share the knowledge that I had without getting flustered. And then if I didn't have the answer, it was easy to say, I'm not sure,
yeah,
you know, can you clarify or whatever it was? It was easier for me to do that because I didn't feel attacked,
right.
you know?
I agree. My second time around, it was actually almost fun, and it's just
Mhm.
that confidence makes a difference. So that's my biggest takeaway would be to just make sure you study a lot so that you feel
Yeah.
confident
And work with other
and
people. Like you just have to keep
practice.
back and
Like
forth,
for
practice, practice,
me,
practice.
I can't remember. I feel like I studied with someone, but I can't think of who that would have been. It might have just been
I had like
myself,
3
but
groups that I was like,
I didn't have that
"Oh
kind
my
of social
gosh."
support, but I'm trying to think of who was I studying with, if anyone. I think my co-resident and I, yeah, I think that's who it was. But
Okay.
we had like a once a week session where every
Yeah.
Wednesday for like an hour and a half we would go through cases because a lot of it the stuff, but you need to be able to think through it and talk your way through and then maybe answer a few trivia questions along the way. But if you haven't practiced speaking and verbalizing
Right.
and kind of, I think the verbalization for me at least helped me realize I don't know that well enough to talk about. I better go study that this week. I think that's
Yeah.
really key.
Yeah.
Well, any last tidbits before we go, Sarah?
No, I think that's the biggest thing is just know that you know it and, have confidence in yourself. I mean,
Yeah,
just like with anything else in the world, but it's good to be prepared. It's good to go to these some of the courses. I found the
definitely.
Nashville course very helpful. At least it made things kind of click in my brain. And then
Yeah,
having study partners who you're like actually talking through, one's the examiner, one's the examinee, was
yeah.
super, super
I think
helpful.
the courses are great. And I think especially one where you can go and practice is helpful. But I think sometimes people get bogged down and they're going to 10. I don't think you need to go to more than one, maybe two. I think that's
Right.
just, again, wasting your cash,
Yeah.
being a little too uptight. Well, and thank you. I will say thank you, A-bombs, for changing the recertification because now that I'm at about, I think this might be my 10th year, I am so glad I don't have to study hours and hours and hours and go take another test of
Yeah.
all the trivial little things. So that is such a
Yeah.
relief. So it is getting better. And I'm really glad that, in some ways, they are really trying to make things improve for us. So, all right. With
There
that
you go.
being said, have a good day and we'll catch you later.
All right. Good luck to all those who just took it. We'll be praying for you.
Yes.
Enjoy your time.
Yes.
Yes, your freedom. All
Okay.
right. Bye.
Bye. Thanks for listening to another episode of the Resting Stitch Face podcast. If you enjoyed today's episode, the best way you can support us is by sharing it with a friend, leaving a quick review, or hitting follow so you don't miss what's next. We'll see you next time.